stupid class, Ellis. Okay, thank you, Lupe. Okay, make sure you know the difference between these. Any questions on these? Anoxic literally means what? None. Oxygen. Anything you see A or N in front of a word means no. So the patient is asystolic. Systole is the beating of the heart. If the patient is asystolic, they're dead. And by the way, we don't say dead in the hospital. We never say, oh, the patient's dead. Medical language, the patient has expired. They're asystolic. They're apneic. They're not breathing and they have no heartbeat. Lupe's probably laughing at me. Okay, so be able to understand the difference between dissection, which is to literally take the word apart and tell me what it means, word parts, and define it. So sometimes they're the same and sometimes they're not. So a definition is going to be more detailed. I'm taking this down unless somebody wants to ask me a question about it. Y'all are acting a little, what I call confounded. You know this medical language word? You know what it is when someone's in shock? The patient is obtunded. The patient is admitted to the St. V's emergency room with a level 4 paramedic, a blood pressure of 60/20, heart rate 130, substernal chest pain, and the patient is obtunded. This is what happens when you don't have enough oxygen. And what it really kind of means is, do you know this expression? The lights are on, but no one's home. Do you know this expression? So it means like the patient looks like this, sort of like Mrs. Ellis, and I'm like, yeah. So they're kind of with you, like they know who you are, kind of. Low oxygen conditions produce this behavior in humans, which is, I'm not really completely here. So you can have a patient that comes to the ER that's anoxic or low oxygen, and they know where they are. So say it's Davis and he gets hit hard in the head on some soccer field and he is obtunded. It means that Davis might know who I am, but if I say, Davis, tell me about what happened, he's like, I don't know. Okay, kind of partially having things be working. Okay. Yes, at the beginning of anesthesia. And that's a great question. So Davis asked, is that what happens during anesthesia? And at the beginning, have you had anesthesia? Yeah. It's cool, isn't it? I think it's like super cool. Tell me a little bit about what you experienced.
I don't even know.
Yeah, okay. All right. So Davis says, I don't even know. Exactly. Isn't that what you want, though, when you're going to have surgery? So amnesic. And the weird thing about anesthesia is the drugs that we have, which is like so amazing. You have no sense of like, oh, I've been to sleep now for 2 hours. No, it's like bing, and you wake up. And I used to be a recovery room nurse, and people would wake up and say things like, you know, they're lying on a stretcher, you're sitting on a stool, and you have a monitor here, and the patient's here, and they'll look at you and go, how come I haven't had my surgery? And their surgery's been over for 45 minutes. So they're amnesic, yes. And that's how we want patients. We want patients low functioning, right? And not remembering things. Okay, so those are awesome questions. Okay, then these are just super basics at the beginning. Matrix storage area, what does this mean? What does embedded mean? If you have a nail embedded in your foot, it's stuck in there. Have any of you done that? With a nail or a tack? Gosh, such a healthy crowd. And then of course the behavior of these two kinds of cells. Blasts are builders and clasts are cleavers. They break things open. So these are building, these are remodeling. That's the dynamic process. Dynamic meaning energy required. Process of build, your bone is active. Anybody else online got a question? Are you all tired? What I want to say is, how old are you? Zero reason. My husband told me last night he was tired of me saying, I don't know. Because he asked me a lot of really, like if I'm talking about something scientific, he'll ask me some really specific question, like, what's the chemical signal for an osteoblast to like be busy? I'm like, I don't know. I don't remember. It's a good answer sometimes, especially if you don't know. Okay. What does yellow marrow store? In long bones. Good, I'm gonna let you look that up for Trivia Monday. How about red marrow, anybody? What does red marrow do? Have I taught you nothing? I'm starting to go sad. What does red marrow store? Oh, thank you. Someone, Kenna says blood cells, yeah, red cells. Question, can baby red cells do their job? So we have baby red cells, middle school red cells, and adult red cells. Can baby red cells do their job? Not really, just so you know. So sometimes patients just only make the babies and they're very ill. This is an important one. What's periosteum? Who's, do you know? Peri. Around. It's the covering on your bones. Okay, and then of course calcaneus is supposed to be added. A lot of vocab. A lot of vocab this unit. Questions about these? Ooh. Autoimmune, did we talk about it? So your book talks about rheumatoid arthritis, which is where your immune system attacks your joints. So have you ever seen somebody who's like, you look at their hand and their fingers are pointed that way? Yours are not, but we have patients that come in and their fingers are like, that's where your immune system attacks your joints and ruins them. Yeah. Yes, Kenneth. Questions about these? Nobody seems to have any questions. Can I get an A on my test? I hope so. Okay, couple more. I just will. You're going to. Yeah, that's actually really good test, which is an important skill. Be able to give an example of these articulation types. Pivot joint. We did it yesterday. This is a pivot joint on your head. Right here, pivot joint. This one, what is this one? What kind? What kind of joint is this? Don't say hip. Which one of those is it? Yes, ball and socket. And we can replace it. They're happening, huh? There is one in your shoulder as well, and we can replace your shoulder joint as well. The shoulder joint is more painful. And so what I'm going to say is docs don't like to do it. This one, for some reason, you can replace this joint and the next day the person's walking. This one, which is why I'm really anxious to repair my shoulder, there's just so many nerves in here and so many pain receptors. This takes a lot of time, like 6 to 12 weeks to recover from. Okay. What about suture joints? George has them. So suture joints are the ones in your skull that are open when you're born. They're not hooked together. And then as you grow, and I think about age 2.5 to 3, they solidify. Suture joints are in your head. Yes, exactly correct. So some people are putting that online. Synovial fluid is the fluid in your joints. You have two kinds of cartilage in your knee, right? You've got that disc, and you also got all bones have cartilage, and it's the whole function of cartilage there is to make it smooth. Important. Difference between ligaments and tendons. So I'm not going to review it, but it's important. Just talked about that. And then an arthroscopy or an arthroscope is a surgical instrument to do what?
But,
Have you had it done, David? Okay. Lots of high school students have had arthroscopy already, especially if they're athletic. Yes,
Yeah.
in any joint. So you can have an arthroscopy also of your neck. So you see patients come out of the OR and they have little cuts. And they've stuck an arthroscope in there to look and see, like yesterday when Dr. Romanek was describing, cervical vertebrae 1, cervical vertebrae 2, sometimes people break them. And they're like, oh my gosh, my neck hurts. It's been hurting for a year. They don't go to the doctor, and finally they go to the doctor and they take an x-ray and they're like, oh, C1 is cracked in half. And that can be repaired sometimes with an arthroscope. So this is all good deal. So Kenneth says, yep, bone to bone is ligament, true. Got a big one here that's common called the ACL. And that can be ripped apart in all kinds of sports activities. Tendons put your muscles onto your bones so that you can pull your bones forward. My bicep is contracting, my bicep muscle, not very big, is shortening and pulling my hand forward. If I cut my bicep in an accident, in a car accident, no matter how hard I try, my hand will hang at my side. So this is why when you work in an emergency room, people come in and they're like, I'm fine. I was in a car accident, I'm fine. And I'm like, oh, okay, why don't you sign permission for us to take care of you today? And they're like, I can't move my arm. You're like, that doesn't look good. I'm like, yeah, I can't move my arm. That's why you need to know anatomy. And that's why we're teaching it to you. So, okay. Leave it there. Trivia Monday. Study for your test so you can get a free assignment. And I'm going to show you a video now that explains this vocab for today. We have work time. Let's see. Let's put this up. Just like, I think it's 8 minutes. It's weird.
At osteoporosis, osteoblasts, and osteoclasts using the analogy of a construction site. What hasn't been explained is how exactly the workers and tools function. What is the process behind bone remodeling, and what role does each element play? In this video, we will examine calcium, which is the primary material in bones, to see how its levels are regulated within the body. So calcium is our material. Its levels are regulated metabolically with the feedback loop involving hormones. So by metabolism, we are simply referring to chemical reactions and processes that occur within our body. And hormones are messengers that stimulate specific responses from different areas in the body through feedback mechanisms, which are simply just cause and effect circuits that feed back into themselves. Let's continue to break this down. Why do we need calcium in the blood anyways? Well, calcium is necessary for muscle and nerve function, as well as blood clotting. This physiology can get complicated, so we won't go into more detail, but it is important to know that calcium is a necessary element of blood plasma. Let's now examine calcium metabolism, and more specifically, the feedback loop that keeps calcium levels within the blood constant. The body works constantly to maintain stable, balanced conditions. This is known as homeostasis. There are two glands that work to maintain blood calcium homeostasis, the thyroid and the parathyroid gland. Both of these glands make and release hormones that work to maintain this balance. When the body has low blood calcium levels, the parathyroid gland reacts by secreting parathyroid hormone, also known as PTH. PTH increases blood calcium levels by activating osteoclasts, which, if we recall, are responsible for breaking down the bone to release calcium from the bone into the bloodstream. PTH also activates vitamin D, and vitamin D increases the amount of calcium that is absorbed through the kidneys and through the small intestine. So as you can see, parathyroid hormone, or PTH, acts to increase calcium levels in the blood. Now you may be thinking, what? I thought vitamin D was a tool used to help build bone. And this is correct. Vitamin D is an essential tool for bone building. And if we recall, bone building involves taking calcium from the bloodstream and using it as the primary material to build bones, thereby decreasing blood calcium levels. But now we also see that another role of vitamin D is to increase kidney and intestine calcium absorption. And what that means is that more calcium is going to be absorbed from the kidneys and from the intestines instead of being flushed out of the body through the urine or stool, thereby increasing blood calcium levels. So we can see vitamin D serves two completely different functions, one that acts to decrease blood calcium levels and the other that increases blood calcium levels. So let's now examine the other side of blood calcium homeostasis. What happens when calcium levels in the blood are too high? When there are high levels of calcium in the bloodstream, the thyroid gland produces calcitonin. Calcitonin is a hormone that increases bone building, meaning that more calcium goes from the bloodstream into the bones. And how does calcitonin do this? Well, you can think of calcitonin as a police officer who is stopping the vandals from taking apart the building. Thus, calcitonin stops the osteoclasts from doing their job. Calcitonin also inhibits the reabsorption of calcium within the kidneys. This means that more calcium is flushed out of the body through urine, thus lowering calcium levels within the bloodstream. So basically, when blood calcium levels are high, calcitonin is secreted, which signals for osteoclasts to be inhibited and for the reabsorption of calcium in the kidneys to be inhibited. Thus, blood calcium is decreased. So let's review blood calcium homeostasis. When calcium levels in the bloodstream are too low, the parathyroid gland releases parathyroid hormone, or PTH. PTH acts to activate osteoclasts, as well as activates vitamin D, which, if we recall, works to increase the amount of calcium that is absorbed into the bloodstream through the kidneys and through the intestines. Thus, calcium levels within the bloodstream rise. And when calcium levels within the bloodstream are too high, the thyroid gland produces calcitonin, and calcitonin acts to inhibit osteoclast activity as well as inhibit the reabsorption of calcium through the kidney, thus calcium levels within the bloodstream will fall. And here's a summary of how these two systems maintain blood calcium homeostasis. And lastly, let's review the different roles of vitamin D. So vitamin D is an essential tool for building bones. And when it is used to help build bones, this decreases blood calcium levels. But vitamin D is also important in increasing kidney and intestine calcium absorption. And when it serves this function, it acts to increase blood calcium levels. I hope this video has helped you to better understand how calcium's levels are regulated metabolically through a feedback loop involved.
Okay. Super simply, I'll do it for you in just a second. Super simply, we have 12 places in your body that, and those of you that want to be docs and nurses, this is a week of class in college discussing this very topic. So there's my nice bone. You can pick which one that is. You see? So I have 2 places that calcium can be. Here's my bloodstream. Really good storage place. So this is in the plasma portion, she said, of your blood. What does this mean? Plasma. Okay, so we haven't learned that yet. So what's in your bloodstream? Blood fats, all different kinds of immune cells, occasionally a bacteria or two. There's a bacteria. Okay, here's a red cell, the ones that are made in your bloodstream. What's their job? They always look like they have a little baseball hat on. They actually do. Red cells, you have red cells, red blood cells in there. What do? They carry oxygen. They also carry sugars. So you have all this cells and stuff in your bloodstream. And you also have this kind of thin fluid that's kind of yellow, and that's called plasma. So all of these cells are floating in this fluid called plasma. So when they say plasma levels of calcium, so calcium is being delivered all over your body, and it helps with lots of different things. She's only mentioned a couple. One, muscle contraction. So if you have really low levels of calcium, you'll get more of kind of little heart palpitations. Like you'll be sitting in class. Does this ever happen to you guys? And you'll be like your heart just beats an extra time. Sometimes drinking Red Bull will make that happen. So low levels of calcium are helpful for muscle contraction. But the question is, you have this cool, there's a human, you have this cool, you can actually feel your thyroid. Looks like a bow tie kind of in your neck. And so when your doctor goes like this, they're feeling for a couple of things. They're feeling to see if you have any big infected lymph nodes. And they're also feeling to see if your thyroid is enlarged or small, because your thyroid is in charge of homeostasis of so many chemicals. So that's what I was thinking about when she was talking. The metabolism of what happens in the thyroid has 2 parts. Thyroid makes calcitonin, which is a calcitonin. That doesn't look right. Okay, whatever. And the parathyroid, so where is it? Now that we have understood the difference between parathyroid and parathyroid, the parathyroid gland is where? You can tell by reading the word. Yeah, it's beside the thyroid. And actually where it is directly behind. And so the thyroid has this cool shape, which looks like a butterfly. And the parathyroid is like teensy, like we're the size of a dime. Tiny, tiny. And it is posterior, like right here. So a lot of times, if someone's having their thyroid removed, they accidentally pull out the parathyroid. You think this is a mistake? Yeah. Because then the patient can't regulate their where their calcium is as well. So to summarize what she said, if I have low levels of bone calcium, The thyroid gland will produce a hormone that moves calcium from the bloodstream into here. So it can make matrix, right? That's what matrix is made out of. If my bloodstream gets really low in calcium, I'm going to be in big trouble, I can tell you. My parathyroid hormone will reset. It has chemical receptors that will measure and go, not enough to do muscle contraction and carry on metabolism. Let's take some out of the bone and put it there. That's all I care about that you know about these two right now. So yesterday, when Dr. Ram and I were also talking, we were talking about if you get labs, so students sometimes just don't know this. How does your doctor know what's wrong with you? How do they know? I think it's a great thing to think about. Yes, thank you, Parsa, you are correct. And Kenneth too. How does your doctor know what's wrong with you?
Yeah.
They ask you, some of them do. They're very bad practice. What do you think's wrong, Uriel? I don't know. You have a big headache. What do you think's wrong, Uriel? I don't want that. Doctor, my thing is like, you went to school 15 years. Why don't you figure it out? Okay, good. How do they figure it out? I want my doctor to figure it out, and I want their big fat brain to make me well, right? Amazing amount of facts. Dr. Ram just actually scratched the surface of what he knew yesterday. And I was all the whole time thinking, like, don't teach too much. Like, this is going to get scary for the kids if you teach too much physiology here, because it's so overwhelming when you first look at it. How does your doctor know? They know by labs, by lab work. So they draw your blood. The patient has, very brittle bones or too much calcium. So the patient we talked about yesterday had like amazing, magnificent amounts of calcium. And I said, oh, so on a lab, blood lab, so this is we drew your blood, calcium, phosphorus, red cells, hematocrit, white cells. Okay, so here's all the different things could be in your blood, immune factors. Okay, you'll learn about this in school. And we go over here and I think, ooh, there'll be a red sign on here. This will turn red and it'll say highly elevated calcium in the bloodstream. And Dr. Ram and I both just kind of looked at each other. What it means, guys, just so you know, like it's a mystery game. When patients have huge amounts of calcium in here, it means that there's something wrong with the bone and the bone's releasing too much calcium. Usually it's bone cancer. There's almost never a time when you get that error unless the patient has parathyroid cancer or a disease, or they've got straight bone cancer. Also, the inflammation of cancer will mess with how easily the bone can lose its minerals, and it'll go into the bloodstream so easily. So the patient can be like, oh, I totally feel well, except for I've lost weight and I have this weird pain right here, like right here. And they can point to it. It's not like my whole leg. It's not like my quads or my gastrocs hurt, or I did too much gardening, or I was too busy at the gym. They have a specific pointy pain and a messed up lab report. So that is why you go to school so long, is because you're learning like, oh, what does it mean when the phosphorus is high? What does it mean when the patient's red cells are in short supply? Okay, this is the mystery game of medicine. Yes. So Kenneth says, yeah, your patients can have bad symptoms when they're feeling sick, of course, but the worst thing is when they don't have very many symptoms and they still are sick. Because then it's less obvious and harder to find, right? Less clues. Okay. All right. Are there any other questions about vocab or what we're doing next week, Monday, Tuesday? To review, 2 deals coming up for intro students. I just told my office I've never done this in all the years I've taught. I would like to grade papers this weekend, but I have nothing to grade. Okay, so I'd like you to hand in your work, look at Synergy. Monday, Trivia Monday means up to 10 points that you can sub in on any assignment. And if you get an A on the unit test, you get another assignment free. Such a deal. Okay. So yeah, so Kenneth says there might be like 500 kinds of diseases. Add a 0. So for internal medicine doctors, there are probably 5,000 diseases that, and the patient never says, you know, hey, you know what? I have leukemia. You're just looking at all of their signs and symptoms. Yeah, it's a giant puzzle. And it is hard to memorize. I will say yes, Kenneth. But the other thing I want to say is that, remember I told you that when you go to school, you're doing it with your friends. It's like being in high school, but everybody's becoming whatever their career is. And so it's kind of fun, actually, because you're helping each other pass tests and you're helping each other like move forward. And you're also talking to each other about who the really horrible instructors are and who the really good ones are. So you're like, oh, don't take Dr. So-and-so, like she's awful. You know, so you're helping each other with that kind of stuff too. Okay, so now work time. I would really love it if on Canvas I had an assignment for everyone. I think there's only one student that doesn't have an assignment out before the end of the class period. If you need me, personal chat me. And I'm done. I'm done for today. Get out your Chromebook and hand in an assignment. Okay. Oh, thank you, Kenneth. That's a good point. On the module, there is a Google Doc that I shared to you, which is a thank you for Dr. Romanek for coming to class. So if you stay in health careers or in medicine, you will learn that this is a really like important rule that exists in medicine and really doesn't exist in the rest of culture anymore very much. Formal thank you notes. Like you go to, you're a student and you go to work in an ICU, you take after you're done, you take a written note to the ICU manager and thank her for letting you learn in her department. So there is a Google Doc. Please just don't sign your name. Please just, and this is also professional courtesy, write one specific thing you learned. Hi, Dr. Romanek, thanks for coming to class. I learned that your nerve for your right shoulder is in the cervical vertebrae. I learned that lots of times people that have right shoulder pain also have a problem with their liver. Whatever it is you learned, I learned that I think I can do medicine. And then share that to me and I'll ultimately share it with Dr. Ram as a thank you note. Okay, thank you, Kenneth, for reminding me.
You're welcome. So guys, I'm actually just gonna, so Emily's asking me about the 2 bone drawing, and the assignment simply means this. Your giant human 2 is supposed to have a long bone on it with bone marrow in it. That's one of the drawings, that little long bone. And then either drawings 1 or 2, which would be the very first drawing we did, which was the matrix drawing, or the next drawing, which is compact bone and spongy bone. Okay, so you need to turn those into me. So it means you can either send them to my email, you can upload them onto, I think you could upload them onto Canvas. Emily, are they on Canvas? Can't remember. I think they are. So you need to draw, you had, the one of them is the long bone drawing that's included on, and I'll just grade that, but the other one needs to be uploaded. Okay. Great question.